Yeah, so entropion usually refers to rolling in of the lower lid, although very rarely it can affect the upper lid. That's much less frequent. And it's a very irritating and much more functional condition, I'd say, than what we've just discussed, because the entire lid and lashes are rubbing on the eye. And this could just be like the lower part of your eye, the white part, and cause irritation and redness and watering. But it can even be higher through like the cornea or, affect vision, and you can get scarring there. And if scarring progresses, even ulceration and the risk of infection. So it is a really troublesome problem to patients, and one we want to rectify for them quickly.
So is this something that also can gradually happen to us through age?
Usually, yeah, usually it is an related problem we call involution, or kind of weakening of the supporting structures of the eyelid, the ones that both lift the eyelid vertically and horizontally. Much more common in people who are eye rubbers or blinkers
Mm.
frequently. In Australia, a lot of the tightening of the skin means the eyelid might go the other way, but we find in people who suffer from allergies or wear contacts and are frequently irritated, they might be squeezing more, and it gives them more of a tendency to roll in rather than rolling out. It can occasionally result from some scarring, which can be
Mm.
either due to unusual infections such as trachoma or even inflammation.
And so I'm imagining that a lot of people with this condition are using lubricating eye drops. Is that a satisfactory long-term solution, or does it usually require surgery?
Look, it's a great first step because it's like WD-40 on your joints of your door, especially the thicker you go and you're using gels rather than drops,
Yeah.
or even ointments. It's a barrier, and it, reduces the rub of the lashes and the lid on the eyeball to relieve the symptoms and the signs that we see. But really, it's not a longer term fix, and the problem is there, and we need to kind of try and do something about that lid position. So there are options, both office-based temporary and more definitive. And so I'd say the office-based temporary, two things we can do. One is a row of Botox injections in the lower lid, or botulinum toxin, is paralyzes the muscle that wants to squeeze the eyelid in and turn and flip it in. But it's a drug, so it works and it wears off in 2 or 3 months. So not the best long-term fix unless you've got a patient in palliative care, or someone who's too frail or elderly to come in for a little procedure. There is another office-based procedure that works really well, and we just, no cutting, just do a row of stitches from inside the lower lid and tie the knots underneath the eyelashes, and it creates a little bit of scarring. We leave those sutures to dissolve naturally. Try not to get the GP or someone to cut it out helpfully, because that creates that enough scarring that will hold the lid out. And we traditionally get taught it lasts for about 6 months to 18 months. I've had a patient who came back 7 years later and it was just worn off. So if you put more sutures in, it can sometimes hold them for longer. But again, that's probably reserved for your frailer patients or someone who's really not wanting surgery, because the surgical fix is fairly a simple, 30 to 45-minute procedure in usually a day surgery facility, where we're tightening the lid horizontally as well as the muscle that has got loose, and tightening that vertically as well.